Hello, and welcome to Medication Administration. Before we get started, I want to show you the test that you're going to be using today to make sure you have the right test. As a reminder, please make sure that it's one test per person. If you're a two-parent home, please do not put both persons' names on the test. This test is 10 questions long. A lot of filling out, a lot of writing on this test. So I'll make sure that I go a little bit slow today so that we can make sure we get all of the answers. Now, once you've completed the test, you're going to turn that into your Pathways Family Specialist. The Pathways Family Specialist will grade that, upload it to your file, and give you the credit for it. If you have any questions, as always, please refer to your Pathways Family Specialist or their supervisor because they're going to be most up to date on the needs of your home and your specific case. Feel free to email me and I'll answer any questions to the best of my ability as well. So getting started today, we're going to be talking about the administration of medications, how to store them, lock them, document them, destroy them, a lot of different things today. This is the third quarter quiz, or third quarter training rather. So starting off, what are the things you need to administer medications? You must have a written general consent to administer routine, preventative, and emergency medications. When a child is placed in your home, CPS is going to have you sign the medical authorization. The medical authorization gives you that consent to not only administer medications, but also consent to any type of medical treatment, dental exams. In the event of an emergency, if you were in a car accident, you can consent to emergency surgical procedures. Otherwise, those have to be planned in advance, like tonsillectomy or tubes put in their ears or wisdom teeth extracted. But in an emergency situation, you do have that consent. You learn that information through the online DFPS medical consent training, if you'll refer to that. For psychotropic medications, you must obtain written, signed, and dated consent that is specific to the medication being administered from the person who's legally authorized to give medical consent before administering the medication to the child. There is a specific CPS form that you will have the doctor to complete, or the physician's assistant or nurse practitioner that is prescribing the medication. They're going to sign off on that, and they're going to write what the medication is, the benefits of it, what it is treating, like ADHD medication, Concerta, Vyvanse, Ritalin, something of that nature for specifically ADHD, and the effects would hopefully be lowering impulse control and hyperactivity. Once they sign that, that has to be signed and approved by the CPS worker before you can have that medication filled. So please make sure that that is done. CPS can look on the health passport and they can see anything that has been charged to Medicaid. So if you had that medication filled prior to them approving it, they can actually call that into the hotline, and we don't want that to happen. So please make sure we have the CPS worker's permission prior to filling that medication. If that CPS worker declines that medication, it's not the end of the world. We then go to the CPS worker supervisor. We can then go to the program director, program administrator, to the deputy regional director, and then all the way to the state office in Austin. We can continue to appeal those decisions if they decline the medication. Just because the CPS worker says no, that's not the end of the line. We can continue to appeal that decision all the way to the state CPS office located in Austin. So what medication requirements must I meet? You must be knowledgeable about the benefits, risk, and side effects of all prescription medication and treatment procedures used and consequences of refusing them, and providing the name and phone number of the prescribing healthcare professional. One way that we're going to be knowledgeable about the benefits, risk, and side effects is that pharmacy information sheet that comes with the medication when we pick it up from the pharmacy. That's going to tell us any contraindications, food interactions, all side effects, all of those different types of things are going to be on that pharmacy information sheet. For over-the-counter medications, we can look not only on the pill bottle, but we can also go to the website for that information as well, like if it was Tylenol or Advil or something that we commonly use over-the-counter medication. So here are your answers to number one. I'll read these slowly. Like I said, this is a lot of fill in the blanks. If you like, you can pause the YouTube training right now and write these down and then restart it. But here are your answers again for number one. Be informed about the potential side effects of the medication. We just talked about that on reading that pharmacy information sheet. Store medications in the original container. We cannot take the medications out of that original container and put them in any type of Tupperware container that says Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, or putting them in a baggie. It has to stay in that original container. If we have a child that is taking medications at school, we would want to ask the pharmacist, can we have a separate container for that medication? And then that way we count out exactly how many pills that child is going to be needing at the school, and we provide that to the school. Very seldom do we see nurses having to administer that XR at school anymore, because so many medications are extended release. So if you look on the medication and it says Adderall XR, that stands for extended release. So they take it in the morning and it releases throughout the day. If you open that pill, it's usually the one that has all the little capsules inside of that pill that's extended release, and it releases throughout the day. Family visits. If we have a child that is going home for a family visit with mom and dad, they're getting their life together, they're doing everything they're supposed to be doing on their family plan of service, and now we're starting those reunification visits. Please make sure we do the same thing like we would at school. Get a separate pill container from the pharmacist and put exactly the amount of medication that child needs for that weekend. Unfortunately, for a lot of the biological parents we work with, they have substance abuse related issues. Not only that, a lot of our psychotropic medications have street value. So therefore, if we sent that child home with Adderall or antidepressants, anti-anxieties like Xanax and Zoloft, those do have street value. That child may not return home with all of their medications, and Medicaid will not approve for them to be refilled. So please make sure we're only sending the exact amount of medication home for that family visit or any type of visit that child may be going on. Administer medication according to the instructions on a label or written orders from the prescribing healthcare professional. So we want to make sure that we are following those written orders from the doctor, as well as on that medication label. Administer each child's medication within 1 hour of preparation. So we want to make sure that when we give that child their medication, let's say we give their medication every morning at 7 o'clock, because that's when they get up, we're getting ready for school. But on Saturday and Sunday, that child slept in just a little bit later. We want to make sure that we're administering that medication within 1 hour of preparation. Ensure the child is taking the medication as prescribed. Again, we're following those doctor's written orders, as well as the indications on the pill bottle, the instructions that are on there. Ensure that a trained and authorized person is administering the medication to a child unless the child is on a self-medication program. So this is why our support providers have to have instructor-led meds. This is a requirement for them. If that child is left alone with them while they're babysitting for a night or a weekend and they have to administer a medication, they have to have had this class. So this is why it is required in our pre-service 3 class for our support providers, so that they are now a trained and authorized person in administering that medication. Maintain any documents provided by the prescribing healthcare professional on the administration of current prescribed medication. So we want you to hold on to the pharmacy information sheet and those different types of things so that we have all of that information on the medication. The med log needs to be updated at the time of administration. We're going to look at the med log here in just a few slides from now, but it does have to be documented live. So as we're giving that child their medication, whether that's a prescription medication like a psychotropic med, an antibiotic, penicillin, as well as an over-the-counter medication, we have to make sure that we're documenting it live. We cannot sit down for the month of June and write out all of June's medications from June 1st through June 30th. It has to be live. So please make sure that you are updating that live. We cannot physically force a child to take a prescription medication. If they refuse, you have to try behavior intervention techniques. Did we restrict the child's electronics? Did we ground them to their bedroom? Did we discuss the cause and effect of not taking the medication versus taking it and how it makes them feel? If it's a medication like an antibiotic to help them to feel better because of strep throat or an infection, or is this a psychotropic med for something like antidepressant, anti-anxiety, or ADHD med? So once we've exhausted those and the child still refuses to take the medication, we need to make sure that we're documenting that on the med error log. Again, we're going to be talking about that in a few slides for now. Ensure that a child is not given any prescription medication or treatment except on written orders of a healthcare professional. If you jump down to number 10 on your test, the very last question, it says a foster parent may not discontinue or administer a medication without a doctor's written order. So that would be true on number 10. So because we feel like a child may have ADHD symptoms, we cannot start giving them ADHD medication. If a child tells us they don't like the way a medication feels, we cannot abruptly stop it. We have to have the doctor's order on discharging that medication. Some medications, if we stop them abruptly, like antipsychotics, mood stabilizers, they could have a seizure because of that sudden stop in the medication. So some things we may have to gradually wean down in dosages or milligrams. So make sure that we have that doctor's written order in administering or withdrawing a child from their medication. We cannot borrow or administer prescription medication that is prescribed for another person. If we have a child in the home, let's say two kids are both prescribed 200 milligrams of Depakote and one child runs out, we cannot borrow from the other child, even though they still have the same medication and same dosage and strength. We cannot borrow from that for the other child. That's why it's really important to make sure that we're counting their meds and we know how many is left before they're running out, so that we're keeping those meds refilled and those doctor's appointments, medication reviews up to date. We cannot administer prescription medication to more than one child from the same container. Only the child in which the medication was prescribed may use that medication. So it kind of goes hand in hand with that previous bullet point there. We cannot administer that medication out of the same pill bottle. That's for prescription medication. Now, for things that are over the counter like Tylenol, Benadryl, topicals like Neosporin, that's fine. We can use those. It's for prescription medication. So all of those are your answers for number 1. Again, if you need a rewind, pause to write those down, please feel free to do so. Self-administration of a medication. So if a child is administering their own medication, they have to be 14 years and older. The child's parent, CPS, must give written authorization. So CPS is going to sign off on that. The service plan that Pathways puts together must include the self-medication program and requirements for the caregiver supervision. So when we type our service plan and we put that information in there, when CPS signs our service plan, that is their written authorization, allowing that child to be on that self-administration of a medication. The healthcare provider must also be in agreement with it, the doctor, and they're going to base that on their maturity level, their developmental level, and their age. We're using that prudent parent standard as well. Now, we could have, in some situations, where a younger child administers their own medication. If we have a child that's diabetic, they may have to, in an emergency situation, give themselves insulin. For a child that's asthmatic, they may have an emergency asthma inhaler where they have to give themselves their own puffs of albuterol or whatever that asthma medication may be. So there are instances where a child will administer their own medication and be a younger age. We also have to remember this is for our children that may take an acne topical medication that's prescribed by a doctor, or a topical face wash. That would also be self-administration of a medication. So we kind of got to keep those things in mind, because sometimes we just think of an actual pill that we're taking when there's other things that could be a medication for topicals like face wash or I can't think of the name of it, and a topical medication like a Neosporin type medication. Also, the child who records the dosage of a child on a self-administration program, we would like for the child to do it. They're showing us maturity level and those types of things. But at the end of the day, ultimately, it is the responsibility of the caregiver. So it is your responsibility to make sure that you're logging it on that medication log. Please don't get into a power struggle with the child on them making sure they're writing this down. We could also reflect on normalcy and the normalcy training that you're required to take. As a child, ask yourself, did you have to record all the medication that you took? No. And usually your parents said, if you have a headache or whatever, go in the kitchen and take a Tylenol. As foster parents, we can't do that. Medication has to be locked. We have to administer it to the child. We have to record the dosage. So when we kind of look at normalcy of things, you know, it's not normal for a child to document their own medication log. We just have to make sure that it is being documented, though. Non-DFPS children. If you jump down to number 6 on your test, we're going to kind of jump around just a little bit with our order of our test. So jump down to number 6. A non-DFPS child could reside in a Pathways foster home when a biological parent or legal conservator voluntarily places the child with CPS, or when a child is placed with Pathways from another state. In these situations, the following will be the medical consentor. So here's your answers to number 6. It's either the biological parent, the legal conservator, or the out-of-state child services worker. I know this may be a little confusing. Pathways doesn't do voluntary placements, but if a biological parent called and wanted to voluntarily place their child in a foster home setting because of maybe they're critically ill, or their financial situation, the child's behaviors, the parents' mental health, maybe they're going into some type of substance abuse treatment, inpatient facility. In those situations, there are agencies out there like Pathways that do take voluntary placements. So in that situation, the biological parent would continue to be the medical consentor or the legal conservator, because that could be a grandparent or an aunt or uncle or cousin or an older sibling that may have custody of that child that is going through those same situations. And then an out-of-state child services worker would be when Pathways accepts placement. It's usually ICPC, which stands for Interstate Compact Placement Commission, where another state, we'll use Georgia as an example, places a child in Texas with their grandparents. So it would be an out-of-state placement. And so that would be the out-of-state child services worker. Medication storage and destruction. If you jump back up to number 2 on your test, these are your answers to number 2. So it's not just this slide, it's going to be the following one. So if I'm going too fast for you and we move on, again, you can pause the training and write these down, or just continue to listen. We have to store medication in a locked container. So the locked container has to be something that has a key or a combination lock. It cannot just be out of the reach of children or in some type of Tupperware container. It has to be in a physical locked container. Keep medication inaccessible other than to caregivers responsible for stored medication. So what that means is, let's say we have a locked container like a toolbox with a padlock on it, or even some of our families will change out the doorknob on a closet and they will use the closet for that locking device. So when we lock it, we don't turn around and hang the key on a key hook next to the closet, or where that child can grab that key and then unlock that lock, wherever that lock may be. That would be inaccessible other than to caregivers. Store medication covered by the Schedule 2 of the Texas Controlled Substance Act under double lock in a separate container. For an example, a double lock can include a lock on a cabinet or filing cabinet and the door to the closet where the medications are stored. So we have to have two locking devices here. Schedule 2 of the Texas Controlled Substance Act, guys, this isn't just psychotropic meds like antidepressants, mood stabilizers, anti-anxieties, or ADHD medications. These can also be muscle relaxers and painkillers. Those are Schedule 2 medications. Any type of controlled medication has to be double locked, 2 locks. And we're going to give you some examples of those within pictures and here in just a couple of minutes. A pass-through door cannot be used as a locking device. We cannot use the bedroom door or the bathroom door as a lock, and then we have the medication in a locked container. The only door that can be locked is like a closet door, like a linen closet or a closet in the bathroom, not a pass-through door that we're going to walk in and out of, like the front door, the back door, a bedroom door, or a bathroom door. Make provisions for storing medication that requires refrigeration. So even our refrigerated medication has to be locked. Here's where I would recommend a plastic device, a container versus a metal container. If you have a glass shelves on your refrigerator, opening and closing the doors creates condensation. The container will sweat, and the more we open it in a metal container, it's going to start rusting, and then you're going to have that rust ring on your glass shelf. So this is where I would recommend a plastic container, like a little toolbox. The little bank bags that you put money in that zip and lock at the end, those work really well. You can find those on Amazon. But any type of medication that requires refrigeration, you need to think about having that locked as well. Keep medication storage areas clean and orderly. We also want to remove any discontinued medication immediately and store it in a separate locked area until it's destroyed within 30 days. That could be because there's expiration. We have Tylenol that's expired. You got to get rid of it. You have to remove it. If the child is discharged from your foster home, the CPS worker picks up the child and returns them home, and they left the medication. We have to hold on to it for 30 days, and then we can destroy it. So that's whenever we would want to remove that discontinued medication. Remove medication on or before the expiration date and store it in a separate locked area until it's destroyed within 30 days. Remove medication of a discharged or deceased child immediately and store it in a separate locked area until it's destroyed within 30 days. This is usually our medically fragile children. If we have a child with a terminal diagnosis that passes away, usually hospice is with that child, and they immediately start destroying that medication and documenting that as well. Prescribe prescription medication to the person to whom a child is discharged or transferred if the child is taking the medication at the time of discharge. So we want to make sure that we are giving all of that information to the CPS worker whenever we discharge that child from your home. So here are some appropriate locking devices. So you can see here we used one that's a lock box that has a combination lock. You can find those at places like Target or Walmart, Lowe's, Amazon. Amazon's your answer for almost everything. The locking bank bags, I really like. That's the one I was using as an example for refrigerated medications. A door handle. This may be your cheapest way to do it. A $10 door handle, and we replace the door handle to a closet. But not only do we use that closet for locking medications, you can also use that to store your chemicals in. Or if you had a child that self-mutilates, we would put all of our sharp objects in there. Or if you had weapons, you could put your weapons in there as well. So it's kind of a one-stop place for that lock, anything that needs to be locked up. Toolbox. Here now, because there's 2 locks on this toolbox does not constitute double locking. This is the only picture I could find of a toolbox with a padlock on it. A lot of our families will use a toolbox because they're cheaper. You can get a giant toolbox, a plastic one from Lowe's or Home Depot for $10, $12, $15, and then put a padlock on it. That's what a lot of our families use, because it also, if you were evacuating your home in an emergency, you can grab that toolbox and throw it in the car, and automatically you have all the children's medications, your medications, and they're locked, and we can transport them as well. So if you had the need for a double lock, then we would put that in a smaller locked container within the toolbox, shut the toolbox and lock it. That would be our double lock. File cabinets, you may already have a file cabinet in your home that locks. So this also is an excellent source of to be able to lock something with. Now, here are our not acceptable devices. This is any type of child safety latch is not an acceptable device for medication. So anything that would go over the door handles to a cabinet, or the kind that fit over a doorknob that twists where you have to squeeze to be able to open it, is not acceptable. The little safety latches that we push down to open cabinets or drawers, or magnetic locks. Magnetic locks are not an acceptable device for medications. For chemicals, yes, but not for medications. So those are not acceptable devices there. So we provided you pictures because some people seeing them works a little bit better than visually hearing it. Discontinued or expired medication. We kind of talked a little bit about this a while ago, and the medication storage, but this is number 3 on your test. Foster parents must properly destroy medication in accordance with state and federal law in a way that ensures children do not have access to it within 30 days after. So here's your answers to number 3. It has been discontinued. The doctor has written a discharge, and we can now take that child off that medication. The expiration date has passed, and this is usually with our over-the-counter meds, vitamins, anything of that nature, Tylenol, even our topicals like A&D ointment, Neosporin, Bacitracin, those all have to be discarded. Medicated lotions like calamine lotion have to be discarded. The child has left care without the medication. So that's whenever CPS might have picked up the child to return home, to go to a subsequent move, or this may be an older teen child that has ran away and they've been gone for 30 days. And so they're not coming back. Now we have to discard that medication. So that's when we would destroy that medication. And also, if the child left without the medication, we do want to hold on to it up to 30 days. Give that CPS worker an opportunity to come pick it up, or even take it to their office so that we can provide it to CPS so that they can give it to the child once the child comes off of AWOL status. Medication records. How do we log our medications? So what records must caregivers maintain for each child receiving medication? We have to keep a med log that Pathways will provide to you. So caregivers must maintain a cumulative medication record for all prescription medication dispensed for the child, as well as non-prescription medications and supplements that are dispensed to a child under the age of 5. This is one of your test questions. Number 4 on your test. I had to find it. So number 4 on your test is the cumulative record. So guys, this is where we need to make sure that we're locking anything that makes the body feel better, whether that is not only medications, but supplements, which could be vitamins, minerals, omega-3s, probiotics, essential oils also have to be locked when we're using them for a medication means. The cumulative medication record must be updated within 24 hours of administering the medication. Again, this is where we're saying we want to document it live. We want to make sure that as we're giving that child that Tylenol, that Benadryl, that antibiotic, that Adderall, we are documenting it live, and so that we're keeping that that updated. This is number 5 on your test. Caregivers must maintain the medication record, which includes, so number 5 on your test is where you're going to put these bullet points. And this is all going to be, again, on our medication log, which I'm about to show you. So the child's full name, the prescribing healthcare professional's name, the doctor that prescribed the medication's name, the reason the medication was prescribed for prescription medication. So whether it's an antibiotic, an antihistamine, a steroid, or psychotropic meds, we're putting the reason the medication was prescribed. The medication name, strength, and dosage. The date, and you'll see that at the top of the medication log, which will have the day, month, and year, and the time the medication was administered. The name and signature of the person who administered the medication, which could be you, it could be the school nurse, or it could be your babysitter. The child's refusal to accept the medication. And what we did, that's where we're going to document it on our med log, the med error form, I'm sorry. The reasons for administering the medication, including specific symptoms, conditions, or injuries of the child and the caregiver, that the caregiver is treating only for a PRN psychotropic medication, which we very seldom see, or a non-prescription medication and supplements for child under the age of 5. So hopefully everybody got those. Hopefully those first couple were easy ones to write down. Now we also have to make sure that the caregivers must document in the medication record each non-prescription medication or supplement that is given to the child and how often the child receives the medication or supplement. So if we're giving that child a multivitamin or multimineral every night at dinner, make sure you're writing that on your med log. Caregivers must document any prohibited prescription medications. For example, medication allergies or contraindications, or prohibited non-prescription medications and supplements in the medication record. So if we have a knowledge that this child has a reaction to certain type of antibiotics or other medications that have been attempted in the past, make sure that we're document any prohibited prescription medications. You must incorporate the medication record into the child's record. You're going to turn that into pathways every month. So here's the medication log. You can see everything that we just wrote down for number 5 on your test is going to be included on this log. The child's name. You can see the day of the month. It starts 1 through 31 at the very top. So if today was July 6th, you would go on and over to the number 6, and then you would start documenting from that number down. That would be the day of the month. You can also fill in the family's name, the month, and the year. You can see on here, we're going to list the medication that the child is prescribed, the dosage, the diagnosis. If this was a psychotropic med, what is the diagnosis? Or if this child has strep throat. The effective date, the day the doctor prescribed it. The duration, is this a 20-day supply of an antibiotic, or is this a psychotropic med that is the refill is good for 60 days? So we're going to write 60 days on there. The doctor's name, the pharmacy name, and the pharmacy information. We want to put that on there because if your babysitter is babysitting and that child has a reaction to the medication, by looking on this medication log, they're going to know how to contact the doctor or the pharmacy to be able to ask their questions if this is a side effect or reaction to the medication. So that's why we want to include that information on there. This particular medication log has up to 4 different types of medications that we can document on here. And then at the end of the month, you want to make sure that you sign it and you put your initials and you turn that into your pathways worker by the 5th of the following month. So if this was June's medication log, you would be turning it in by July 5th to your pathways family specialist. So that's what the medication log looks like. And then here's the med error log. So the medication error log is to be used when a fault in the administration of a medication occurs. All errors must be documented within 24 hours. So again, we want to document that live. As that child is refusing the med, we forgot to give it, whatever the case may be, we want to make sure we're documenting it live. So errors could include the child receiving the wrong medication, That could happen if you're talking on the phone and you have 4 kids and you just accidentally gave little Billy's medication to little Susie. We just gave them the wrong medication. So we want to document that on the med error log. When the child received someone else's medication, same scenario, the wrong dose of medication was administered. And sometimes we see this with liquid medication. If we're pouring out cough syrup, we may have given the wrong dosage. The dose was skipped or missed. This is the most common. It's not the end of the world. Let's say it's the weekend and we went and caught a movie and it was late. When we got home, the kids were asleep and we put them straight to bed and we missed a dosage. Make sure that you just document that on the med error log. The medication administered was expired, and this usually happens with our over-the-counter medication is when we may find an expiration date. Administration instructions were not followed, or the medication was not properly stored, and that's where it may be a refrigerated medication is where we may run into that incident. If there is a medication error regarding a prescription medication, the foster parent must contact a healthcare professional immediately and follow their recommendations. My recommendation is call the pharmacy. Our pharmacists are the most underutilized healthcare professional out there. Call the pharmacy and ask them your questions. Call the doctor's office. If it's after hours, sometimes they have a backup service that answers and can connect you to someone. If you look on the back of your Superior Medicaid card, there is a 1-800 number for an RN hotline, a registered nurse hotline. You can call that hotline as well, and that is a healthcare professional. So those are some people that would be able to guide you in that situation. If there's an error regarding a non-prescription, this would be an over-the-counter medication, foster parents must take the appropriate and necessary actions required by the circumstances. So again, look on the pill bottle. Is there a 1-800 number on the pill bottle? Look on their website. Also, call the pharmacy or call on the back of that Medicaid card, that 1-800 number, and ask that healthcare professional. Those are people that are available to you through Superior Medicaid. Medication errors. For all medication errors, a caregiver must document the following on the med log. We're going to document the time and the date of the error, what the medication error was. Did we skip a dose? Did the child refuse it? Did we give them the wrong medication? Was it expired? What that error was. The time and date of the call to the licensed healthcare professional. So write that down, who it was you talked to on the phone. The name and title of that healthcare professional, and the healthcare professional's recommendations. Now, guys, if this healthcare professional recommends that you take this child to the emergency room, you have to follow through with that recommendation. If you don't, that could be seen as medical neglect and could initiate an investigation. So we want to make sure, even if you don't agree with it, we still have to follow through with that healthcare professional's recommendation. Here's what the med error log looks like. So again, at the top, we're going to put the child's name, date of birth, and the month. And then down here at the bottom, we're going to document the date and time of the error, the type of error, and there's a whole list for you, 1 through 8, the different type of errors that could be listed, the date and time of the call to the healthcare professional, the name and title of the healthcare professional, and the healthcare professional's medical recommendations. So that's how we're going to help you to have a little graph of all of that information, making sure that you document it and that you are also notifying pathways immediately of that error. So please keep us in the loop. Even if it's late at night, you have 24 hours to do it, but the sooner you tell us, the better. If ever in doubt, please call your Pathways Family Specialist. If for some reason that you have not heard back from them and it's been 5 or 6 hours, call their supervisor. We want to follow through with that because maybe your Pathways Family Specialist is dealing with their own personal emergency. So that there is that backup person for them, which is their supervisor. The med error log can be located on the family web. When you log into Extended Reach and you go to the child's file, you can see there it's highlighted in yellow. The medication log is going to be there where you can open it and print it, as well as the med error log. So you can locate that on the family web as well as requesting it from your Pathways family specialist. They can email it to you, or they can print these and mail them or bring them out on their home visit. So just let them know how it is that you want to receive them. So do any of these medications have to be locked and documented on the med log? So this is number 8 on your test. So here we're looking at melatonin, which helps with sleep. It could be Flintstones multivitamins. It could be calamine lotion if we get a child that gets into poison ivy. Visine or any type of medicated eye drops. Any type of diaper rash creams, ointments, topical medication. The answer is true. We have to document all of those. So please make sure that you're documenting any type of medication or supplement that we're giving to that child. Again, they not only have to be locked, but they also have to be documented. When in doubt, always ask your Pathways family specialist. Another one we should have added on here is essential oils. For families that put it behind their ear, on their wrist, for a cold or anything like that, please make sure you're documenting on your med log that essential oil, as well as storing it, locking it like a medication. Prescription label errors. If there's a medication error regarding a prescription medication, the foster parent must contact the healthcare professional immediately and follow any recommendations. So if you do see a med error label, you want to contact your pharmacy immediately and let them know about it so that they can correct that mistake. Bring it back in. Not only was it a medical label error, that pharmacist needs to double check and make sure that ADHD medication wasn't some type of cholesterol medication for an adult. Have them double check the medication and that label error. We need to make sure we're giving the right medication. Safety is always our primary goal here. If there's an error regarding a non-prescription, the foster parent must take the appropriate and necessary actions required by those circumstances. Here's what the prescription label may look like. It's kind of an example. I'm sure you've seen many different types, whether you get your prescriptions filled at CVS or your grocery store like Kroger, Costco, Sam's, or local pharmacy. They all look a little bit different, but contain the same information. Medication refills. In the event the pharmacy will not refill a medication, it's imperative to be persistent in calling the prescribing physician to either approve the refill or contact the pharmacy to clarify or verbally approve the medication. So sometimes we run into this where we think we have a refill and we get there and the pharmacist says there's not a refill. And so they want to call the doctor's office to confirm. Make sure you're documenting this. Again, this could be seen as medical neglect if we're not following through with getting that medication filled. So you want to call the doctor's office and let them know the pharmacy's not filling it so they can call them directly. Make sure you're talking to the pharmacy that they're calling the doctor's office to get that approval. Some pharmacies may not keep psychotropic meds in stock. If the prescribing physician issues an electronic prescription to the pharmacy, a new one will need to be made if the pharmacy is changed to another location. In this event, you may want to request a paper prescription. More doctors are going towards electronic prescriptions because there's less fraud happening. If a person steals a prescription pad, they can write bogus prescriptions. Again, because of street value. So we want to make sure if it was an electronic prescription that was called into your pharmacist or your pharmacy, and they did not have that medication and they have to transfer you to another pharmacy, they won't transfer that prescription. You will have to have that doctor call in a prescription separately to that other location. And so that's where you may want to try to see if you can get a paper prescription. Let that pharmacy know that you're going to be a frequent customer there, and that's the medication that that child takes, so that they can make sure that they keep that medication restocked. Make sure to document all communication between the pharmacy and the doctor when having difficulty in refilling a medication. And then our residential childcare regulations will issue a citation when a medication is not refilled and a child misses a dose. So this is where you really got to make sure that you're keeping up to date on those medications and how much medication is left. I would recommend the blister packs, which is the cardboard, and the back of it is foil, and you can pop them out. You can visually see those blister packs, how many pills are left, versus a bottle. We don't look, we just dump one out, put the cap back on, and the next thing you know, there's 2 pills left, and our doctor appointment is 2 weeks away. So that's one way to make sure that we're keeping up with that child's medication. The medical report form. The medical report form should be used to document medication, medical, dental, vision, hearing, and behavioral health. Anytime we have an appointment, we want to make sure we have that medical report form. This is also good for the CANS assessment, which is the Child and Adolescent Needs and Strength Assessment. That's a behavioral health appointment that we would want them to fill that out for. Completion of this form is not required for allied health services such as physical therapy, occupational therapy, speech therapy, or dietary services. Completion of this form meets residential child care regulation minimum standards, residential child care contracts, and child protective services policies. So we do at Pathways use CPS medical report form. Here you can see is it 5 or 6 pages long? I turned them into little pictures. They're side by side here. But you can see we want to fill this out anytime we go to the doctor, the dentist, medical appointment, vision and hearing screening, whatever it may be. This is the medical report form you take with you. Cheater's tip, a lot of our families make multiple copies of this and they keep it in the glove compartment of their car because it never fails. You get to the doctor and you forgot that medical report form. So make 10 copies, put them in your glove compartment of your car, and that way you always have them with you. You can pre-fill some of this information, the child's name and date of birth. So that way, we're not having to fill out some of those things over and over again, your name and your address and all. And then we would have the doctor complete this at the time of the appointment. Medication side effects and reactions. What do I do if a child has an adverse reaction to a medication? So if a child does have an adverse reaction, we want to immediately call a healthcare professional. Again, that could be the pharmacy, that could be the 1-800 number on the back of the Superior Health Medicaid card, that could be your doctor, or even an urgent care if you call an urgent care. This is number 9 on your test. I knew this was a question. I just couldn't figure out which one it was. We want to make sure we follow the healthcare professional's recommendations. If whatever it is that they ask us to do, to go to the emergency room, whatever it may be, follow through with that recommendation. Seek further medical care if the condition worsens. If the rash continues to spread, if the swelling continues to swell, whatever that reaction might be. Document the adverse reaction the child had. Rash, swelling, lip smacking is actually a adverse reaction to medication. Lethargic, whatever it might look like for that child. The time and the date of the call to the healthcare professional, the name and title of the healthcare professional, and the healthcare professional's recommendations. So please make sure you're getting all of that information. So again, that was number 9 on your test. What do I do if a child has side effects? Same things. We want to document the observed and reported side effects. We want to immediately report any serious incidents or serious side effects to the child's pediatrician or their psychiatrist so that they can either alter that medication, maybe they need to completely take them off the med, decrease the dosage, whatever the case may be, and then report any other side effects to the prescribing physician within 72 hours. Psychotropic meds. What information do I need to administer psychotropic medications to a foster child? So with Pathways, we must have the following in writing or a documented discussion regarding the child's diagnosis. So again, this could be that CPS document that we sign, that we have the doctor fill out that says what the medication is, what the diagnosis is, the nature of the child's mental illness or condition, an explanation of the purpose of the medication, a description of the benefits that we expect to be seen from the medication, a description of any accompanying discomforts and risk, including those which could result in long-term use of the medication and possible side effects, including side effects that are known to frequently occur in persons, side effects to which the child may be predisposed, and the nature and possible occurrence of irreversible symptoms, sorry. And then a statement of whether the medication is habitual in nature. So we want to make sure we're getting that form signed by that doctor for CPS to sign off on. We also want to look at any alternative interventions to the use of psychotropic meds like therapy, psychological evaluations, and any type of treatment that is recommended from that. Other alternative treatments or procedures to the use of psychotropic meds, risk and benefits of the alternative treatments or procedures, risk and benefits of not receiving or undergoing treatment or procedures, an explanation that the person legally authorized to give medical consent may ask questions about the child's response to the medication and may review your daily records. That's your right as a medical consentor. An explanation that the person legally authorized to give medical consent may withdraw consent and request the medication be discontinued at any time. So if you're seeing that that child is becoming lethargic, or they're not eating at all, or they're eating all the time, or they're not sleeping at all, this is your right as the medical consentor to request that medication be withdrawn. The healthcare professional must offer to answer any questions the person legally authorized to give consent has about the medication, and the person must sign a consent that acknowledges that you have provided all of the information set forth in subsection A of this section. A copy of the signed consent must be filed with the child's record, so you would give that to Pathways as well. Emergency psychotropic meds, and guys, you're probably never going to experience this. It's not something that's very common. If a physician determines that there is an emergency that requires the administration of a psychotropic med, then you must follow the physician's orders and do not need to obtain consent prior to the administration of the medication. I can tell you in all of my years, I've only experienced this once where the foster parents, it was a shot. I think it was either Haldol or Risperidol that they had to give the child if they became extremely aggressive, and they would. So they did not have to have that consent to give the medication because it was an emergency medication. The biological parent or managing conservator, so in our world, the managing conservator, which is CPS, must be notified within 72 hours of giving that medication. The physician's statement of the emergency and prescription must be obtained and documented in the child's record. So again, you're probably never going to experience this with a child in your care. This is something, if a child is this aggressive, they're going to be in probably a residential facility. Their behaviors are going to be too extreme for a foster home setting. And documenting that psychotropic med, again, we need to maintain the Pathways medication log. We would document it immediately upon giving it in the medication log. Document any noticeable change in the child's behavior as a result of the medication. If there's any noticeable changes in the child's behavior, report those to the prescribing healthcare professional to use for the evaluation of the appropriateness of the continued use of the medication. You must obtain the physician's evaluation and give it to your caseworker for the child's record. So again, we want to make sure we're documenting if the child's losing their appetite, eating too much, not sleeping at all, sleeping all the time, irritable, whatever it may be. We want to make sure we're documenting that and staffing it with the doctor at that medication review so they can determine do they need to increase, decrease the dosage, or discontinue that medication altogether. And they're going to document their evaluation on that medical report form that we just showed you a couple of slides ago. So that's where they're going to be documenting their evaluation. After that doctor's appointment is where you're going to provide that to Pathways. When we upload that to the extended reach database, it sends an email to CPS, to you, and anybody else that we may have on that child's file as a person that needs to receive that, like CASA or the child's therapist. Given the unusual stress and change in environmental circumstances associated with being a foster child, counseling or psychotherapy should generally begin before or concurrent with prescription of a psychotropic medication. The patient and caregiver education about the mental disorder, treatment options, non-pharmacological as well as pharmacological treatment expectations and potential side effects should occur before and during this prescription of the psychotropic med. So make sure you're educating yourself, get online, do your research. Some other factors that could complicate a mental health diagnosis. Foster children in particular have multiple needs, including those related to emotional or psychological stress. Typically, they've experienced abusive, neglectful, serial, or chaotic caretaking environments. The birth family history is often not available to us for us to relay to that doctor. The establishment of rapport is sometimes difficult, especially if that child has had multiple placements. These children often present with a fluidity of different symptoms over time, reflective of past trauma and reactive attachment difficulties that may mimic overlapping psychiatric disorders. When we're administering that medication, the 4 things we want to remind ourselves, well, first of all, are we giving it with or without food? Any contraindications to that medication, and then the 4 rights. The right medication, the right dose to the right person at the right time. So kind of go through that mentally as we're giving that so we're not creating a med error there. Other than that, guys, that concludes the training. Again, please make sure as you fill out your test, remember it is 1 test per person. You want to turn this in to your Pathways family specialist, and they in turn are going to grade it, upload it to your file, and put a certificate with it, and then it will calculate those hours. If you have questions, again, I'm going to refer you back to your Pathways family specialist and the supervisor, because they're going to be more knowledgeable about your current situation, case, and the needs of it versus me. You are more than welcome to reach out to me, and I will answer any questions that you may have, or may reach out to your family specialist and supervisor for more information before I give you that information. Follow through with that. So other than that, that's all that I have. I hope this was informative and you got something out of it. Please let us know in either way we can improve this, and we will see you next time. Thanks so much for joining.